magandang araw at magandang taon araw-araw. At sabihin ko lang sa inyo, ito ay sa ngalan ng buong Red Cross, Board of Governors at ang Secretary General na si Lisa Zavalla na tumatangkilik sa mga ginagawa ngayon ni Cora Alma de Leon na magkaroon tayo ng kalinga para sa bagong buhay, para sa bagong pagkakataon. At hatid po ito ng Red Cross sa Radyo Pilipinas. Tangkilingin po nyo para marami tayong mapulot na makakatulong sa buhay ninyo. Mabuhay ang Pilipino, mabuhay po kayo. God bless you. We all love you.
Kung pamunuan ng Philippine Broadcasting Service, Radyo Pilipinas, sa pangunguna ng ating buting Direktor Bong Aportadera, sa ating Station Manager Senyor Alan Alianige, sa ating mga kabalikat Mr. Maki at Mr. Ray Sampang, at siyempre pa sa ngalan ng ating butihing kalihim Martin Andanar ng Presidential Communications Operations Office, ang inyo pong Kuya Francis, minsan pa nag-aanyaya. Saan man kayo naroon, ano man ang inyong ginagawa sa mga oras na ito, samahan po ninyo kami sa isang makabuluhang edisyon na naman ng ating Kalinga, Hatid ng Red Cross. Hanggang alas 4 mga kaibigan, sama-sama po tayo. Huwag po kayong bibitiw sapagkat napakahalaga ng tema ng ating talakayan ngayong episode na ito. First Sunday of the month of February. At kapag nababanggit ang Pebrero, hindi lamang yung mga puso ang ating pinag-uukulan ng pansin. Gayon din, kinakailangang bigyan po natin ng masusing pagpapahalaga, masusing diin ang kalusugan ng ating mga ngipin. Dental Health Month episode natin ngayon. Ito po ay talagang iikot ang ating tema sa pagpapahalaga ng ating kalusugan sa ngipin. Lalo na ngayong panahon ng pandemya. At napakapalad po natin sapagkat makakasama po natin sa kabuuan ng ating episode ang presidente ng Philippine Dental Association. Ipakikilala po namin yan sa inyo. Mamaya-maya lamang, get ready, get your paper and pencil. At antabayanan po, samahan kami till 4 o'clock. At narito na ang ating kaagapay sa ating episode. Walang iba kundi ang butihing Governor ng Philippine Red Cross, Cora Alma de Leon. Governor Cora, a blessed February Sunday.
Yes. Good afternoon. This message is from retired Chief Justice Hilarion Davide Jr. for our program. On this beautiful Sunday, the 6th of February, the month of love, my family and I pray for you. May God always grant you and your loved ones a wise and understanding heart. In everything you do, in every place you go, may the love, grace, and peace of God be with you. May He continue to provide you with all your needs and to inspire you to be joyful sharer of your blessings. May He keep you healthy and safe from COVID-19 and all other evils. May He guide you in all your undertakings in accord with His will and for His honor and glory. And may God continue to give you the spirit of power and love and self-control and not the spirit of cowardice. Enjoy your day. God love us all. Amen. Tama-tama.
Amen.
Para
Amen.
kay Dr. Angelo Militante. Thank you.
Okay, at Governor Cora, kapag binabanggit ang salitang militante, hindi ito yung mga militanteng grupong nagrarally, ha? Hindi po yan. Hindi yan. Ang ating pong respetadong panauhin ngayon na presidente ng Philippine Dental Association ay si Dr. Jose Angelo G. Militante. Siya po ay isang dalubhasang doktor ng dentista sa ngipin. Okay, salubungin natin ng isang magandang hapon. At bago natin ibigay ang background at mga pinagdaanan ni Dr. Militante, salubungin natin ng isang magandang hapon at raming salamat po sa pagpapaunlak ninyo sa ating Kalinga Hatid ng Red Cross. Dr. Militante, good afternoon and welcome.
Hello po, Kuya Francis. Kamusta po kayo dyan? At Ma'am Cora, good afternoon po. At salamat po ulit at naimbita niyo po ako in behalf of the Philippine Dental Association.
Yes.
Okay. Dr. Angelo, yung pangalan po ninyo ay napaka-familiar sa akin. Militante. Are you from Quezon, sir?
We have relatives, sir, from Quezon, but the ancestry of the Militante mainly comes from Iloilo, no? Iloilo.
Okay.
And some of them went to Bicol, then Quezon, kumalat na po.
Aha. Nag-migrate na ng husto ang Militante. Ano po? Okay. Now, Governor Cora, meron ka bang curriculum vitae ni Dr. Angelo para malaman ng ating mga kababayan kung gaano kadalubhasa si Dr. Angelo?
Well, unang-una, siyempre tatanungin natin saan siya nag-aral, ano yung kanyang naging karanasan, paano siya naging Pangulo na napaka-importanting samahan ng Philippine Dental. Actually, ang pangalan nila, Philippine Dental Society, di ba? Society ba o association? Anong pangalan niyo?
Association po, Ma'am Cora.
Association,
Philippine Dental
yes.
Association.
Okay.
Ayun.
So, pwede yung ikwento, pero alam mo, sa pagngiti mo lang, kitang-kitang perfect ang ngipin mo. So, you are an epitome of your practice. I'm just making light of our discussion, pero totoong nakakatuwa na makita na ehemplo ng Philippine Dental Association, ang Pangulo nila, napakaganda ng ngipin, kahanga-hanga, which we don't share. Kami ni Francis mapapahiya dito.
Maganda rin dahil pantay-pantay ito dahil pagawa ito. Hindi
Bakit?
na.
Dahil nasira na.
Dahil sa katandaan. Ay, naku po, wag na 'yon.
Hindi.
Okay.
Sa kapabayaan. Kasi
Ayun.
ang nangyari, yung ngayong mga generation ngayon, talagang kaiba yung mga ngipin, alagang-alaga compared to sa mga matanda, mga lola na hindi na alagaan. Pero diretso na tayo kay Dr. Jello. Saan ho kayo nag-aral, yung background niyo? Saan kayo, bakit kayo nag-decide na maging dentista? Yun lang ang tanong ko.
Okay, salamat po, Ma'am Cora. Okay. First and foremost po, ako po si Dr. Jose Angelo Militante. And my friends, and my fellow dentists call me Dr. Jello. Mas kilala po ako na Dr. Jello. And I graduated from Central Escolar University on the year 2001. And I have been in the practice of dentistry for the past 20 years. And my specialty po is oral and maxillofacial surgery. Kami po yung kinoconsider na mga surgeons na mga dentista. So yun po yung background ko. Then I became president of the PDA last year, 2021. And nag-guest na rin po ako dito nung siguro 4 years ago when I was still a vice president, And na-meet ko po si Sir Francis, si Sir Edison, and I'm sure si Ma'am Cora wala pa noon. So naalala ko po yun kasi medyo naligaw pa ako noon, tapos face to face pa, Face to face pa. Yes. Medyo kakaiba na yung mundo natin. So yun po yun, Yan po yung short history ko of being a dentist. And of course, I also went abroad for additional education. So I took up my specialty there. So is oral cancer reconstruction. So ang specialty ko po is oral cancers.
Galing.
Yes, Governor.
Yes, of course ang tatanungin natin sa kasalukuyan, ilan na ba ang miyembro ng inyong association? Kasi over time nakita ko na maraming mga kabataan na nag-aaral ng dentistry and pamosong-pamoso ang Central Escolar University for that. At talagang kahanga-hanga ang Central Escolar University for that. Go ahead,
Yes.
Dr. Jello.
Tama po kayo, Ma'am Cora, kasi ang Centro Escolar is one of the first
Yes.
dental schools in the Philippines. And of course, tama po kayo that medyo malaki po talaga yung number natin. But there are other schools also na who's coping up with the numbers. And as of now, we have around 14,400 members of the Philippine Dental Association. Pero kung iisipin niyo po, malaki nga ba? Pero kung ilalagay niyo po sa ratio ng 110 million na Filipinos populasyon,
Hindi kaya.
hindi kaya.
Yeah.
Maliit po talaga. Maliit po
Yeah.
yung ratio ng dentista, no? Sa
You cannot even have
no.
you cannot even have one dentist per barangay, because barangay you have 45,000 barangays. So
Yes,
you cannot,
exactly.
malayo pa talaga.
Which is the ideal, no? Ideal population is 1 is to 50,000.
Yes,
In
yes.
population. So, but that's
Ayun.
impossible sa atin.
Pero Dr. Angelo, being the president of the Philippine Dental Association sa ngayon, kamusta po ang tie-up ninyo sa Philippine Red Cross insofar as the programs na nakalatag ngayong Dental Health Month?
Yes, sir. Actually, no, Sir Francis, yung tie-up namin with the Philippine Red Cross is actually, is not seasonal. It's actually perennial, no. We have been part of the Philippine National Red Cross in terms, number one, in terms of in your blood, blood donations, no. We have 97 dental chapters all over the Philippines, and majority of them we have partnered with local chapters of the Philippine National Red Cross in terms of blood donations. And malaki pong tulong yun. Ma'am Cora, nagpapasalamat po ako at na-meet ko rin kayo kasi malaking tulong po yun kasi a certain percentage, of the blood that came from, that we got, from those donation drives are actually being used, by dentists. Alam natin kung gaano kahirap kumuha ng dugo ngayon, So that's one advantage, And the second advantage po na in partnership of the PDA and the Philippine National Red Cross is in terms of training, yung basic first aid, at saka po yung basic life support. And most dentists actually have started and also already trained with the Philippine National Red Cross, which we believe is a much needed skill right now for all dentists.
Pero Dr. Angelo,
Sige, go ahead.
ngayong February, which is Dental Health Month Awareness, maike-carry out ba ninyo ng husto ang mga programang nakahanay ngayon, looking back na meron pa tayong pandemya sa buong kapuluan?
Yes, Sir Francis. Actually nga po, let's go back to the first one, na project with the Philippine National Red Cross. On February 20, we would have the biggest simultaneous blood donation drive in the whole Philippines, And part of it is the local chapters of the Philippine National Red Cross.
Okay.
So kasi as we believe, as long as we practice proper infection control within the area, we could still push through with the activities. So it's one. Second, yung Philippine Dental po, kasi medyo mga very resilient po kami mga leaders ng PDA, we have already adapted to this what we call the new normal. And actually most of the conferences, the scientific meetings that we have is via this remote communication or virtual platform. And all our activities, though they are face-to-face, they are limited and of course consensus po with the IATF and LGU guidelines. Kaya po tuloy-tuloy po yung aktibidades po ng Philippine Dental Association during the National Dental Health Month.
Okay, Governor.
Yes, I will cite two examples. I have a sister who's already 88 years old. Siyempre, nag-recede na yung kanyang gums, so the upper dentures ay hindi na talaga fit, Pero yung iba ba, she's living on the lower dentures. Yung bang ganong edad, pwede pang mabago yung kanyang dentures para she can eat naman comfortably. What do you think? I think ang kailangan dyan parang reconstructive, hindi ba? Kasi nagbago na yung nagbago na ang gums, nagbago na yung because of aging. What can you say, Dr. Angelo? Sorry nakukonsulta na ako sa
Yes, ma'am. Actually po, ganito po yun, One of the prime responsibilities of dentists, which I always tell my fellow dentists during the lectures, is always to provide good quality of life. When you say good quality of life, it means that no matter what age, no matter what sickness that the patient would have, we always have to provide good quality of life. So kasama po dyan yung kinonsulta nyo na age na 88 years old. Yes. Ideally po kasi Ma'am Cora, no, dentures are meant to be replaced every 3 to 5 years. Ganun po yan because of the changes of the oral cavities, the gums, the teeth, which are changing, no, during those time. And of course, you add up also the medicines that the patients are using. Kasi there are some medicines which is nitrogen containing, such as yung mga steroids, no, yung mga gamot for the asthma, tapos yung for diabetes, no, they can actually cause and reduce no bone formation. So mga ganun po. So kung sasabihin niyo po na posible ba? Yes, posible po. With the technology right now in dentistry, we can always do the impossible.
I believe that, no, because alam mo, ang isang tao na usually payorya, ang yung softening of the gums, na kahit magaling na okay naman teeth mo, nahuhulog ang ngipin, nauubos, and therefore you end up getting dentures. And nung araw, alam mo, pag may masakit ang ngipin, bunot. Kaya ang tawag noon sa mga government hospitals, Dr. Bunot. But the reality yun because wala naman nag-iisip na save the teeth. Hindi naman pinapasave, basta masakit, tanggalin. Parang, kaya tawag namin noon, mga Dr. Bunot Kasi lalo na sa mga government hospitals, wala kang gagawin, pupunta ka doon dahil libre, bubunutin lang kung ilang ngipin bubunutin. Anyway, I didn't mean to be disparaging, but that was the practice at that time. And I think
yes,
technology...
and also ma'am, I agree. I agree. It has been a constant practice and a misnomer for us dentists that every time we go out for outreach programs, they would call us Dr. Bunot. However, I think 4 years ago, we started to change the practice of iniiwasan po namin magbulot ngayon. We more recommend education and prevention and intervention. So yun na po yung ginagawa namin. We go more for conservative dentistry para mabawasan na po yung misnomer na Dr. Bunot.
In fact, totoo yan. Kasi ang aming mga pamangkin, lahat ang gaganda ng ngipin. Walang pangit ng ngipin. Because they, dental consultation is a must. Kailangan pupunta sa dentista. Hindi porke masakit ang ngipin, pupunta sa dentista. Kailangan check-up. Dental check-up is the magic word, I think. So, in practice, alam mo, there are dentists and there are dentists. Talaga sa lang. I know somebody, she's an American but Filipina staying here, complaining that it's so expensive, Cora. The dentist here, kasi depende ka ako, if you live in a condominium, they will match it. Kasi the condominium ka nakatira, so siguro you can afford. But I think it's, hindi naman ruthless ang mga doctor, ang mga dentist. You can explain to them that you're in a pension and kung pwede, and you can maybe, survey saan mura na dentista. Ewan ko, palagay ko, pwede namang mag-survey. And now that we know, Dr. Angelo, I am sure we can consult him para saan ba pwedeng pumuntang hindi naman nananaga, to use the word. I'm sorry.
At saka, Governor Cora, baka nagbibigay sila ng 20% discount sa mga senior citizen.
Yes, actually po, we do encourage our dentists, our dental professionals that we give 20% discounts on
very good
on senior citizens and of course PWD on the professional fees, Kasi ang one thing po kaya nagmamahal po ang dental services sa Philippines, though that we are still considered developing countries, yung dental materials po natin talaga is napakamahal.
Yes.
Imported
di ba?
Ma'am Cora, and of course, as a dentist, we know the quality of the materials that we do. If we go for cheaper brands, which is coming from China, syempre the quality is a little, hindi naman po sa pagmamaliit is a little not good, but most of the quality dental materials and equipment would be coming from siguro is Korea, Taiwan, Swiss, Germany,
quality.
UK, which is more expensive. But from there, we can actually predict the outcome. Yun po yung maganda doon. We can actually predict the outcome of our treatment na mas maganda po yung kakalabasan.
Aha.
And ano po, Ma'am
nawala
Cora
na,
and
Francis.
Yeah.
Oo. Nawala na yung gold teeth. Yung ginto.
Wala na. Oo.
Kailan ba nawala yung gintong ngipin? Kasi may mga taong may gintong ngipin pa di ba? Saan ba yun Kailan nagsimula na at kailan na nawala?
Actually po, Ma'am Cora, it has been an age-old practice that making gold teeth or noble metals is being used for paggawa ng ipin sa dentistry. Kaya nga lang, because of the scarcity of the gold, number one, scarcity of the gold that is being used for creating teeth sa
Inlaid, di ba?
dentistry.
Inlaid yun?
Yes.
Outlaid yan.
Yes, I think it's around, hindi ko po matandaan kung 14 karat or 18 karat gold ang kailangan po doon. Tapos minimix pa po yun with other metals para at least maging stronger. Kasi kung gold lang po, they're highly malleable. But the good thing is nothing can beat crowns or restorations made of gold kasi tumatagal po talaga. And the second reason po kung bakit nawala is the skill.
Yes.
Is
Wala
the
nang
skill.
gumagawa.
Yes, yung mga dental laboratories natin, not all of them are highly skilled in doing such. And the third one, it's very expensive.
Yes, I'm sure.
Very
Ito
expensive.
Kaya
Yes.
sabi nga, mayaman. Pero on maintaining cleanliness, of course, a niece gave me yung Polydent na 2 boxes na yung parang pill, yung parang tablet, which is for 3 minutes. And I found that very, very good in cleaning the teeth in the evening or in the morning para parang it's always clean, it's always fresh. Siguro, but it's expensive because Polydent na ay expensive. Pero kailangan ma-orient pa. I think we need to orient the people. When is it necessary? Ano yung mga maintaining? Kasi sa mga seniors, parang wala nang wala nang ngipin, hindi na pinapalitan. Sabi ko, hindi. Pwede kayo magkasakit sa puso pag hindi tama ang ngipin. Ako nag-a-advise na bad for health na hindi maganda ang ngipin. Hindi alaga ang ngipin. Francis, ikaw na.
Okay, thank you very much, Governor Cora. Itatanong lang natin kay Dr. Angelo, may datos po ba ang PDA ng mga Pilipinong may problema ngayon sa ngipin, lalo na sa panahon na ito ng pandemic? At ano daw ang edad na mas nagkakaroon ng problema ang isang tao?
Okay. Thank you for that, Sir Francis. Naalala ko you also posted that question when I was there several years ago. Let's go back to a little history. Way back 2007, the World Health Organization or the FDI, World Dental Federation, released a data stating that the Filipinos has a very poor oral hygiene.
Yes.
Wow.
Yes.
Wow.
I think in Southeast Asia, we are number 2. I think 97%. Tapos because of that, it posed a challenge for us now sa PDA. So that's why we created programs to manage that and address that. So no 2011, even though after 3 years, we are still number 2 at 91%. So mataas talaga. And the common age, believe it or not, is children from 6 to 12 years old. So after that, ang latest survey that we have, which is a good news naman, which is the good news, in 2018, Department of Health released, made a research that we are already number 11.
Wow.
Kasi naging effective yung programa natin.
Good news.
Around 79 or 77%. But that was 2018 po, Governor Cora and Sir Francis, 2018. And the following year, ano nangyari? Pandemic.
Yes.
Nag-close
Hindi
ang lahat
nakapunta
ng
sa
dental
dentista.
clinic for 2 years.
Yes.
So expected nyo na po, number 1, government dental clinics nag-close. Why?
Yeah.
Kasi mga gobyernong dentist natin sa government, they went into the vaccination program. That's one.
Yeah.
So So, and most, no, some of the dental clinics of the government are not fully equipped for COVID-19 sa clinic nila. Kasi that would entail, gastos po sa government. And the budget of the government is reallocated to the vaccinations. And so, ang nangyari, yung mga private dentists, kami yung mga nag-invest on our dental clinic. And for us to invest and return to practice, we have to spend around 150 to 200,000 per dental chair.
Yeah.
For us to be able to move into practice again. So kaya nga po iisipin natin, tumaas talaga ang dental services because of the pandemic. No? So yun po yung masama. So kaya nga po ngayon sa PDA we have this foresight na baka right now we have a looming problem in oral health pag natapos ang pandemic. Ang question is, kailan matatapos ang pandemic?
We don't know. We don't know. But there must be a way of the awareness program, I think, should not stop. And we have, of course, the social media to be made available. Kasi if you say na kailangan so many years, and maximum 5 years sa mga dental, it's not really possible kasi it's expensive. So you kind of maintain it until masira. Para bang gusto mo masisira lang ng, in fact, anong pinagdadasal, wag mabubungi. Kasi minsan na-aksidente, nabubungi. And that is the only time you will change it. Ang tendency is to remain using, because it's still functional. But you are correct There must be a way of giving, para din sa kotse, merong lifespan. May lifespan din ang ngipin. Francis, ikaw naman.
May dagdag ko lang din po,
Yes.
Ako po may brand na ako sa PDA president. Sabi nila, I'm the most interviewed PDA president. Sa lahat po, sa radio, sa TV. The reason po, bakit? Kasi sabi niyo po, Ma'am Cora, to utilize the social media, and the media to deliver our message. Kaya nga po ako, pag may pagkakataon na may imbitahan ako, ginagrab ko yung opportunity to spread out the advocacies of the Philippine Dental Association in promoting good oral health. Kaya po malaking pasasalamat po talaga ako. Then imbitahan niyo po ako ngayon.
Yes.
Okay. Now,
Dalang correction, Francis.
Yes.
Hindi na tayo Philippine National Red Cross. Philippine Red Cross na tayo. Aalisin na ng national. Papa-remember lang natin kay Dr. Angelo. Para naman, meron kang, because of this interview, you found out something new sa Red Cross. Wala nang national.
Okay. Now, Dr. Angelo, dahil sabi mo nga, napakalaking challenge ngayon ang kinaharap ng PDA to reach out itong ating mga kababayan para magkaroon na ma-broaden ang kanilang awareness na kinakailangan ng oral health care. Pero sa panahon ng pandemic, sabi mo nga, nagsara ang maraming mga private dental clinics. Pero naniniwala ka ba na yung marami nating mga kababayan kung mangangailangan ng mga false denture would go to the underground economy style na yung mga dental laboratory technician na lamang ang kumokontrata na mas higit na mura kaysa sa talagang lehitimong mga dental clinics. Dr. Angelo?
Yes, Sir Francis, actually po tama kayo, very rampant po, ever since po very rampant ang illegal practice of dentistry. Hindi lang po sa dentures, kundi pati sa braces. Nakikita niyo po online, may mga nagbebenta ng braces at nagkakabit online. And it has been a perpetual problem of dentists and the Philippine Dental Association. Why? Kasi as we all know, these people are not properly trained to do such things. And because of such fact, it is not allowed by the Philippine Dental Act of 2007 for other people not registered dentists to practice this field. Kaya nga lang po, ang problema is hindi po natin mapigilan basta-basta kasi number one, may mga nagtotolerate.
Yes.
May nagpapatronize.
Yes, and the reason why they are doing that is number one, economy, poverty.
Cheaper.
Yes. And for us to incarcerate all these fake, practicing illegal practitioners of dentistry, we have to file several cases around the Philippines.
Yes.
Dinidemanda po namin lahat yan, pinapakulong namin. And napakarami po nila, hindi namin
Yes.
Kaya
Parang
that's why,
parang kabuti yan, Dr. Angelo, parang kabuti.
Yes,
kahit na saan distrito, dito lang sa lugar mo, Sampaloc, napakarami.
yes,
But
tama
maybe,
po kayo. And tama
but
po
maybe,
yung,
go ahead.
Sir Francis, ang problem po is after, naparusahan sila namin, na monetary, makakalabas sila. Tapos, after 5 years, babalik na naman sila.
Yes.
Hindi po talaga mahinto.
Well, ang message
Governor Cora, saglit lamang po.
palit tayo.
Magbibigay
Palit tayo
daan
ng
lamang tayo sa isang paalala mula sa ating himpilan.
Malasakit para sa mga paslik. Pamahalaan ngayong panahon ng pandemya ay lubusan ang pag-iingat sa kalusugan at kapakanan ng mga kabataan.
Prepare na po tayo sa vaccination ng 5 to 11 years old. Ngayon, mas prepared po tayo at mas experience. We will open our vaccination rollout sa February 4.
Maingat na pinaghahandaan at may kapanatagang ligtas ang COVID-19 vaccine na kanilang tatanggapin.
Makaka-assure po tayo na very safe ang ating gagamitin na bakuna dahil ito ay mas mababa ang formulation na angkop para sa mga bata.
Tiwala at pakikisa ang kailangan para lubos na mabigyang katuparan ng pamahalaan ang pangakong sa pandemyang kinakaharap ng bayan ay walang maiiwan. Isang mensahe mula sa Radyo Pilipinas.
Nais kong ipaalam na ligtas ang bakuna. Kaya magpaalam na sa maling haka-haka. Nais kong ipaalam na anumang brand, effective. Kaya magpaalam na sa paghihintay. Dahil dagdag proteksyon ang kailangan. Magpaalam na sa pangamba. Ipaalam sa iba ang halaga ng bakuna. Kapag may bakuna, COVID ay mas kaya. Ingat-angat, bakuna lahat.
Narito ang mga kaganapan sa Philippine Red Cross. Sa muling pagtaas ng kaso ng COVID-19 sa pagpasok ng taon, idiniin ni PRC Chairman Senator Dick Gordon ang kahalagahan ng testing. Iminumungkahi ng Philippine Red Cross ang saliva RT-PCR bilang alternatibong paraan ng testing dahil ito ay abot kaya at non-invasive. Halos 5,000 katao na ang nakilahok sa hygiene promotion activities noong January 20. 36,000 na litro ng malinis at ligtas na tubig ang ipinamahagi sa 5 barangay ng munisipalidad ng Trinidad at Ubay. Hindi natatapos ang pagtulong ng Philippine Red Cross sa mga probinsyang nasalanta ng Bagyong Odette. Namahagi ang PRC ng hot meals sa 719 individuals sa Cebu City lula ng mobile kitchen food truck na ipinadala ni PRC Chairman Senator Dick Gordon.
Remember that we did this to protect the people.
Sa panahon ng pandemya,
COVID-19 pandemic.
ating gobyerno ay hindi nagpapatinag.
Prospects for recovery.
Bawat kagawaran, doble ang pagsisikap na nagbunga naman
Strong economic growth in the country.
ng magaganda at positibong resulta.
Making the Philippines one of the fastest growing economies in the world.
Narito ang Office of the Executive Secretary
Sa ilalim ng Office of the President.
Our office undertook what is known as the complete staff work on every proposal we elevated to the President. As of this date, the OES has processed a total of 156 executive orders, 1,257 presidential proclamations, 92 memorandum circular, 44 administrative orders, and 58 memorandum orders.
para sa mga balitang laging tama at totoo.
Radyo Pilipinas.
Sa panahon ng pandemya,
COVID-19 pandemic.
ating gobyerno ay hindi nagpapatinag.
Prospects for recovery.
Bawat kagawaran, doble ang pagsisikap na nagbunga naman
Strong economic growth in the country.
ng magaganda at positibong resulta.
Making the Philippines one of the fastest growing economies in the world.
Narito ang mga nagawang proyekto ng Department of Transportation
Sa aviation and maritime sectors.
Noong pong nag-report ako dito, noong nakaraang Hulyo, nabanggit ko po na yung airport projects sa aviation and airport sector ng kagawaran. Meron pong 214 completed projects. As of November this month, 2021, ang completed projects po ay 233. Meron din po namang maritime sector. Hulyo 2021, ang completed projects is 451 projects. Ngayon po, nakatapos na po tayo ng 484 completed projects as of today.
para sa mga balitang laging tama at totoo.
Radyo Pilipinas.
Hanap mo ba ay balita pero hilig mo rin mag-sound trip? No need to switch. One tab is all you need. Music and entertainment, saktong-sakto, pati sa mga impormasyon at balitang napapanahon. PBS-FM.com. News and information, andyan ang Radyo Pilipinas para sa iyo. PBS-FM.com. One website, daming choices. Pexman, di ka nalilipat sa iba. Visit PBS-FM.com.
Okay, thank you very much. Tuloy-tuloy na tayo sa ikalawang bahagdan ng ating episode, Dental Month Health Awareness. Okay.
Dental health.
Okay. At nariyan pa rin, before going to Governor Cora, meron po tayong tinanggap na text dito para kay Dr. Angelo. Nagtatanong si Yong Lee Hao, magkano daw ba ang magpapustiso? 5 sa taas, 6 sa baba. Matagal
11.
na raw po kasi siyang hindi nakakapagpapustiso. Nako, malaking ano yan, malaking problema yan. Mahirap kumain kapag wala kang ngipin. Okay, wala pa si Dr. Angelo? Wala pa, okay.
Tayo muna, no? Kasi
Yes, go ahead.
gusto ko ding i-discuss natin na yung check-up. Kasi minsan, kung wala naman sakit ng ngipin, hindi nagpapa-check up. Pero sa mga bata, dapat regular ang check-up. And I think it behooves the barangays to make sure na meron silang facility for regular check-up sa kanilang community. Matanda, bata. Kasi para sa akin, pag hindi ito nagagawa, hindi mo naman malalaman na may sakit ang ngipin eh. And I remember yung conjunctivitis is one of those na nakaka-apekto, yung sakit sa gums na ang nangyayari ay nahuhulog ang ngipin dahil ang gums ang problema. So, nakikita ko ito yung nagiging problema. Pero ang importante sa community, dapat maaalertuhan din ng community yung sa ating mga barangay health center. Pag check up nila ng bata, isama na rin nila yung ngipin para malaman kung mangangailangan ng tulong.
Pero alam mo, Governor Cora, napakahirap. Ang mga bata, takot yan sa mga dentista. Pag sinabi mong pupunta kayo sa dentista para pakita yung ipin, nako, talagang katakot-takot na paluan pa bago sumama yung bata para magpa-check up dahil alam niya, i-iniksyonan siya, bubunutin yung ipin, masakit, ay talaga namang napakahirap ang bata.
Ako naman, papakita ko retrato na magiging itsura pag tumanda na. Kasi sasabihin papangit sila. Pag sinabi mong papangit sila, baka magbago. Magbago ang attitude ng mga bata. Panahon na para baguhin natin ang attitude. Nakuha ba natin Dr. Angelo? Andiyan na ba? Wala pa. Ayan na.
Okay.
Connecting na to, audio.
Okay, sige. Ulitin ko lang yung tinanggap nating text para kay Dr. Angelo mula kay Yong Lee Hao. Dr. Angelo, nagtatanong po si Yong Lee Hao, magkano daw po ba ang magpapustiso? 5 sa taas, 6 sa baba. Matagal na raw po siyang hindi nakakapagpapustiso, Dr. Angelo.
Thank you. Actually po, hindi po yung ipin po na nilalagay, hindi po namin binibilang yan. Kasi po yung presyo ng ipin, hindi po namin binibilang yan. Kasi nabibili po namin yan set by set, no? Ang nagdi-differ lang po sa presyo is yung quality ng ipin, kasi meron pong malalambot na resin, merong matitigas na resin, at meron pong highly aesthetic na resin. Tapos po yung quality din po ng denture base, yung kinakapitan ng ipin, yung nakadikit sa lagilagid. Kasi meron pong high impact, no? Meron pong ordinary, so doon po nag-differ yung presyo. Visit po kayo sa dentist, sir, para at least ma-check po kayo mabuti. At saka sometimes po, no, especially pag medyo long-standing na yung pustiso na suot nyo, titingnan po paano i-manage at saka po ano po yung pinaka-best na treatment para sa inyo.
Okay, Doctor, siguro magandang sabihin mo na rin kung saan ang iyong klinika para kung doon sa gustong magpakonsulta at dumalaw sa iyo kahit na panahon ng pandemic, makilala ka ng personal.
Actually po, Sir Francis, pasensya na po, no? It's very unethical for me.
Yes, bawal yun, Francis.
As the president of the PDA to endorse myself, no? But
okay, sige.
But, no, I'm encouraging po, no, all the people, listeners here to visit the nearest dental clinic. And I'm sure, no, and pag sinabi niyo po sa kanila na narinig niyo po si Dr. Angelo nagsalita, sa Radyo Pilipinas, I'm sure that they're very willing to accommodate you and give you discounts also.
Yeah. Ako naman, I feel we should honor our dentist. Ako si I Santos, hindi ko siya ina-advertise kasi di ba bawal, pero sometimes you have to say, in saying thank you, mahalaga na may mention mo na nagkaroon ka ng karanasan na positive experience. I think that should be the statement, a positive experience with the people who have helped them. And I think, believe ako doon sa mga doctor, na mga dentist na nagtsatsaga sa government agencies. Dahil alam naman natin, mababa ang sweldo, not exactly mataas ang magaling ang facilities, pero they continue to serve the government. So, hats off ako sa kanila. Saludo tayo sa kanya, Francis. Dahil kahit mababa ang sweldo, nagtsatsaga sila.
Okay. Dr. Angelo, ano po ba ang pagkakaiba ng dentist at orthodontist?
Actually, sir, ang dentist, no, when you say a dentist, is the general practice, no?
Okay.
General practice. So, general dentist. So, parang sa medicine, is just like a general medicine, parang ganyan. Okay?
Ayun.
Now, pagka-graduate po na isang dentista, no, after 6 years of study, no, if they're willing to take up specialty courses like orthodontics, no, pag naging orthodontics ka po, ang tawag sa iyo, napasa mo po yung exams, you're called to be a specialist in orthodontics, which is you're an orthodontist, no, and we have 6 specialties in dentistry. Para po sa medicine, may OB-GYN, meron po silang general surgeon. Sa dentistry po, may ganyan din because we're trying to level up the practice of dentistry right now in conjunction po with our counterparts abroad. Kasi kailangan po natin mag-level up na in practice of dentistry. And napakarami na pong specialists ngayon sa dentistry. So, alam mo, may need ka po i-root canal, go to an endodontist. Kung may problem ka sa gums, go to a periodontist. Kung gusto mo problema sa dentures na mahirap gawin, go to a prosthodontist. Ganun po, meron po kami mga specialties na ganyan.
Okay. Now, Dr. Angelo, how will you carry on your programs for this February, Dental Month Health Awareness sa iba't ibang bahagi ng ating bansa? Napakahirap pong challenge nito para sa ating mga dentista to reach out, especially doon po sa mga grassroots level.
Yes, totoo po kayo, Sir Francis, no? Kasi ang basic objectives of creating programs namin sa Philippine Dental Association is to make sure that the programs are tailor-fitted on the community that they are into. And napakasaya ko po kasi ako po, ang tawag ko po sa batch namin is batch sinagtala, no? It means that a guiding star, no? And I have 125 presidents all over the Philippines coming from Ilocos hanggang sa Sulu. And they're actually listening right now. And sabi nga po sa akin, meron po tayong version daw sa Mindanao ngayon na Bisaya. No? So tama po
Ah.
ba yun? Translated in Bisaya. And I'm very proud of them kasi no matter how hard this pandemic is, no, they are still continuing pursuing the objectives and of course the responsibilities of being a dentist in their specific area. Yung mga programa, tuloy-tuloy po yan. No? Medyo limited nga lang. Kasi number one, because of IATF, LGU protocols, no? And of course, no funding. Hindi na po ganun kalakas yung funding and sponsorships that we can get from our dental trade partners kasi naintindihan din po namin sila na sila din mismo nahihirapan.
Well,
Okay.
the good
Edison.
news is that meron pang ibang radio programs na we can invite you outside of the Red Cross. So I am sure I will ask Francis to give us your number para we can contact you. Kasi dapat makatulong kami sa pagpapairal ng tamang information about what you are doing. And I think you're doing a wonderful job, and I think tama yung ginagawa mo na you are guesting in as many programs because if people don't know what you're doing, they think you're not doing anything. Ang napansin mo, meron akong bagong frame dito. Ang frame ko dito, parang message in a bottle. Remember the book by Nicholas Sparks?
Yes.
Ang feeling ko, the message that I want to give is message in a bottle. So, but really, it's not just message in a bottle, message in a battle. Kasi ang battle natin is information. Kaya sabi ko nga, just for you today ngayon ko lang inilabas ito. Kaya nga sabi ko, maganda kapag somebody is trying to explain what the message ought to be, kailangan pakita natin how we have to put it in a bottle so people can actually, sorry na lang, hindi to soft drink, ano lang, paper mache lang itong bote na to. Pero minsan, ay mga soft drink, nakasisira ng ngipin. So I want to relate that also, no? Yung mga soft drinks ay nasa bottle, nakakasira ng ngipin.
Okay, Edison, yung tanong mo kay Dr. Angelo, nasagot na kanina pa yung ratio ng dentista at ng mga mamamayan. At least one dentist is to 5,000. Tama ba, Dr. Angelo?
50,000 po, sir, the idea. No?
50,000?
Yes.
Wow. Pero ngayon po, sa lahat-lahat ngayon, all throughout the country, ilan po kayo ngayon na mga dentista?
Okay,
Regardless of specialization.
Yes, sir. Actually, nakaregister po sa PRC, no, sa Professional Regulation Commission, is around 28,000. Pero ang members po, 28,000 po. Pero, pero Sir Francis, ang question dun is, nasaan yung more or less 10,000? No? Kasi number one po, no, some of the dentists, my fellow dentists, no, who are actually retired still renews their PRC license, though they are not practicing anymore. Kasi holding a professional regulation ID or professional ID is some sort of prestige for them, though that they are retired. And some of them are not practicing dentistry already. They are engaged more in business, no, ibang business na. And some of them also resorted, no, working abroad and living in abroad. So hindi na po sila nagpa-practice ng dentistry. But for the Philippines, no, we have around good 16 to 18,000 actively working, no, as a dental dentist, no, here in the Philippines.
Meron bang retirement age sa mga dentista, doctor?
Wala po, Sir Francis. Hanggang kaya ng kamay.
Oo, yes.
Kaya ng
Kailangan,
tuhod at kaya ng mata.
Hindi
Yun.
pwedeng may Parkinson's. Hindi pwedeng may Parkinson's, Francis. Yung gumagalaw ang kamay. Kasi
Ayun.
kailangan steady. Steady ang kamay ng ng mga dentist. Di ba, Dr. Angelo?
Tama po kayo, Ma'am Cora.
Pero Dr. Angelo, sa mga bata po ngayon, dahil ang mga bata ay talaga namang napakahirap ikintal sa kanilang kaisipan, lalo na yung mga age 1, 2, 3, 4, 5, 6, 7, yung talagang pangangalaga, oral hygiene. Ano po, yung pagsisipilyo, hindi pagkain ng sobrang tsokolate, ng mga matatamis and so forth and so on. Paano natin sila hihimukin sa isang magandang paraan na magiging katanggap-tanggap na kinakailangan at early age ay matuto sila ng oral hygiene?
Okay, Sir Francis, wag na tayong lumayo, no? Noong nagkakilala tayo 4-5 years ago,
Yes.
wala pa po na kasi bagong kasal pa lang ako. Ngayon po, may dalawa na akong anak. Isa
Wow!
magto 4 years old at saka isa pong magto 2 years old. Ngayon, noon iniisip ko, paano nga ba talaga mapapangalagaan ng ipin tsaka ma-encourage yung mga bata, no?
Right.
Na mag-toothbrush at saka uminom ng tubig. No? Actually po, proper training and proper values lang. Yung anak ko, to be honest, no, hindi ko po siya iniiwasang kumain ng chocolate and of course candies because those are the happiness of a kid, no?
Right.
However, pag tinanong ko sila, okay, what will you do after eating that candy? Of course,
Brush your
dapat
teeth.
sasabihin ko nila, brush your teeth and drink plenty of water, which they always do. Right now, my 3-year-old doesn't sleep, no? Hindi po siya natutulog hanggang hindi nagsisipilyo, which is a 3-year-old.
Yeah.
So ibig sabihin po, proper training and values, no, lang kailangan talaga. So that's why I encourage po talaga, no, kasi we have this advocacy in the Philippine Dental Association, which is pamilya ko, una kong dentista, which we believe is very applicable right now during the pandemic, that the families, no, the parents, the titos, titas, the lolos and the lola should be the one to be the first dentist of the families of these children. And if we properly inculcate good values with them, then I'm sure that they'll grow up something much better than us.
Okay, Dr. Angelo, yung nagtanong kanina, Governor Cora, na si Yonghee Hao is from Taiwan. Nanonood siya ngayong mga oras na ito at sabi po niya, salamat po, Doc. Mahal po kasi dito sa Taiwan. Nagpatingin na po kasi ako dito. Nasa 46,000. Kasi kaya inaalam ko po sana dyan sa Pilipinas para kung mas mura dyan ako sa Pinas magpapagawa ng postiso.
Pero kailangan may proper visa siya, hindi pwedeng hindi visa. Hindi, pero sa totoo lang, maraming mga Pilipino sa Bangkok nagpupunta para to have dentures. Kaya nga nagulat ako, parang, bakit magaling ba talaga ang mga ties diyan sa mga sa pagdidentista? Kasi parang in ngayon ang advertisement ng mga Thailand tungkol sa dental surgery, dental treatment, di ba? Am I correct, Dr. Angelo?
Yes, ma'am, kasi alam niyo po yung ang maganda po sa Thailand, no? Maganda sa Thailand tsaka sa Korea is they have a very good what we call medical and dental tourism. The government itself are the ones who are actually promoting
encouraging
the practice of dentistry and medicine on their area. So dahil napakaganda ng kanilang equipment, technology, so these patients coming from the Western countries, European, pupunta pa sa kanila, which is true, no? And sa Philippines po, sa Philippines, hindi po tayo nalalayo, no? In the next few years, I've talked with the Department of Health that their gear, after releasing the universal health care this coming May, ang mangyayari po medical and dental tourism na. So we are having standardization of the practice of dentistry in the next few months, para po ang target, is medical and dental tourism.
Nako, Governor Cora, we ran out of material time. Nagpapasalamat tayo kay Dr. Angelo, pero mahaba pa naman ang Pebrero. Maari pa siyang magbalik muli. Depende na lang kay Edison kung tatawagan niya si Dr. Angelo ulit para sa isa pang episode. Dr. Angelo, pwede po ba yun?
Sir Francis, Ma'am Cora, Sir Edison, laki po na pasasalamat ko at nagkita-kita ulit tayo at saka naimbitahan niyo ako sa inyong programa. And anytime po, basta kailangan niyo po ng restore speaker, specialty speaker, and anyone to promote oral health, my lines are open with you. Marami po salamat.
Okay, thank you very much. Mga kaibigan, si Dr. Jose Angelo Militante, President ng Philippine Dental Association. More power to you, sir. Maraming salamat po. Governor Cora, your final message.
Yes, magagawa natin ang lahat ng bagay kundi tayo nag-iisa. Ang pakikiisa natin sa Philippine Dental Association will mark a change also in the dental history of mga Filipinos. I dream of the day na hindi na natin makikita yung mga ngipin ng mga matatanda na sira-sira na dahil nagpunta si Dr. Angelo dito sa ating programa. Thank you very much, Dr. Angelo. We will be militant in your advocacy. Thank you, thank you.
Okay, at sa ngalan po ni Governor Cora Alma de Leon, sa ngalan ni Edison Enriquez at ang buong pamunuan ng Philippine Red Cross, sa pangunguna ni Chairman Richard Gordon, ang ating Secretary General Liza Zavalla at sa ating mga hanay ng Board of Governors, sa ating mga RCY volunteers nationwide, ang inyong Kuya Francis nag-iwan ng mga katagang get out and help make today a better tomorrow. God bless. Hanggang sa muli, maraming salamat po.
We know you're always on the go. Pero ang mahuli sa balita is